Hi, I'm Dr. Javaheri. I wanted to discuss with you today on body implants. One of the differences between body implants and facial or cranial implants is that implants in the facial skeleton, skull, are implants that augment the bone structure usually, whereas the body implants are to simulate or enhance the muscle or the soft tissue deformity. So they're essentially soft tissue augmentation or muscle augmentation procedures. Let's start with the deltoid area. The deltoid muscles are three muscles: anterior, medial, and posterior. Deltoid muscle is essentially a triangular shape. So I usually do a custom implant. In other words, I measure and create an implant based on the patient's desire and the projection that they wish. I have, again, use the engineers from an implant company. They create the implant that I design, and the implant is placed to augment the muscles of the deltoid. This can be used for people who have either accidental injury to a nerve or brachial plexus, a very common type of injury with car accidents or some other falls, and etc., where the muscles are completely atrophied. The implant can be created to simulate that area for that particular patient, or if the patient desires augmentation of their muscles. Implant is placed usually through a small incision above the shoulder, although there are other modalities or approaches that one can take too. Implant can be something like this, except they're wider, more triangular looking, but they're very soft like this. This is a calf implant, but I also substituted for different areas of the biceps or triceps, which will lead me to the next area, which is the biceps. The biceps muscle is the front of the arm, of course. Biceps is a fairly frequent area that I augment. Implant is placed over the muscle, under the fascia, but not under the skin. There's a difference between that. Sometimes implants can be placed under the muscle completely. It's a little bit more technically challenging procedure, but that is another approach that I can do. Implants look something along this lines. They come in different shapes and sizes. They can be something like this, which is more of a medium type, but it can be also larger implant too. The implant for the triceps goes right behind here, and the biceps implants go something like this, or even like this, depending on what the patient wants augmented. These incisions are through incisions that are no more than about an inch in the armpit, so they're very well hidden. The next area that I often do, and they're a little bit related to the biceps, is the pectoral muscle. The reason why they're related to the biceps is because patients' upper torso need to be enhanced. Oftentimes, the biceps and the pectoral muscles are areas that a patient desires simultaneously. But if they don't, there are implants that can be done that are made to augment the pectoral muscle. This is an example of one that's somewhat medium-sized implant. This is an implant that's placed under the pectoralis muscle. This implant can be placed this way to augment more middle part or the inferior part. Or they can even be this way. Whatever the patient desires to have augmented can be simulated. Sometimes the patient desires even larger implant. This is an example of a larger implant, similar shape, but just more of it. Or even much larger implant, something like this. This implant is usually placed like this. This is done, again, through a fairly small incision, no more than maybe 3 centimeters. And it goes under the muscle, using an incision inside the armpit, and this large implant is placed through that incision to highlight the pectoralis muscle. Moving down the area of the body, very common area that people want augmented is the buttocks. Buttock implant. There are essentially 2 types of buttock implant. You can say round or teardrop shaped. The round can be extended to be semi-oval shaped too. There's a special implant that is created to simulate that, but these are essentially it, a round or a vertical implant. I use this specific type of implant mostly on men. The reason I use these mostly on men is because men's buttocks are generally more vertical, not round. And implants are used usually on men on this, but again, I can use anything round as well. These implants are introduced through a small incision, roughly 6 centimeters, maybe 7 at the most, inside the crease of the buttocks, so they're very well hidden. I place these implants inside the muscle. I think that's the best approach rather than over the muscle. Over the muscle is very routinely done, but it's a higher risk of having fluid collection or implant being able to be shifted or turned on itself. It's much less chance of that happening when it's inside the muscle. And also less likelihood of having complications such as fluid collection, although it can occur. The implants are placed through a small incision inside the muscle, and I introduce these implants, and they're covered completely by the muscle. Another area that is very common and very popular is a hip. Hip implant is one implant that is not under a muscle. That's because there really are not any implants in the side area of a person's hip. Essentially, this is a subcutaneous implant, which is an implant that's placed under the skin and fat. Implants are usually designed. They can be any shape. They can be non-designed too, but I usually design these implants specifically for the patient. And I design them in such a way to augment the side of the buttock too. And this is an implant that's for the left side, a left hip implant, and it goes something like this. And the projection is designed in such a way to augment that area that's suited for that particular patient. And these implants, you can see, are ultra soft, but they are solid. They are solid implants, not gel implants. Implants usually they're a very common area of the body is the calves. Calf implant is an area where are two muscles, the gastrocnemius muscles, the medial and the lateral. And these implants are, again, they come in different shapes and sizes. They're meant to augment that particular muscle. Sometimes people are born with congenital deformities, or they had childhood infections like polio, where they have only one side that is diminished. Those are more specialized implants, but they can be augmented using implants, which I think is the best way. Fat grafting is another way, but sometimes we combine the two. Fat grafting is something that usually has to be done in several stages to enhance that area rather than just one operation. I also perform implantation of different areas of the body that I've designed specifically. This is an example of a trapezius muscle. Now, the trapezius muscle is generally a triangular shape. This implant is designed to simulate the person's trapezius. This goes something like this back here, and designed to come over the muscle, so augments the anterior part, not just the back. The shape can be modified to create any shape a person wants. I've created implants that were have two dips basically to simulate double muscles. Some people have different parts of the trapezius that are hypertrophied, and we can create really any implant to simulate the particular muscle. The sides of the muscle are smooth, so the edges are not likely to be seen. Another area that I frequently augment is the thighs. I augment the anterior thigh or the medial thigh or the side of the thigh. These implants can be used, such as the calf implants, to augment some of these areas, but most can be done using customized implants.